The emergency department is that special place in the hospital where critically ill or injured patients come and receive emergency treatment. When you come to the emergency department, immediately you arrive, there's a trained nurse who will actually take your vital signs and try and understand what brought you to hospital and identify if you're having an emergency or if your condition can wait. So based on the information that the nurse receives from you and the blood pressure and all the other vital signs that she takes, she determines how soon you should be seen. And that's why sometimes you'll have patients who come in and are seen immediately. This is because the nurse has determined this is an emergency that needs to be managed in a timely manner compared to maybe what you presented with, which is not necessarily saying it's not an emergency, but this patient needs more immediate attention and we will be able to get to you. So all the doctors and all the nurses within the accident and emergency department are trained to triage and to identify that critically ill patient who maybe is having a heart attack, a stroke, or maybe it's a pregnant lady who's bleeding, or a child who's extremely sick and having difficulty in breathing, or someone who's coming and the blood pressure is extremely high or has serious injuries. And these patients then will be prioritized straight into the department to be seen by the doctors and nurses who are trained in providing the immediate emergency care that the patient required. Now, while you receive the emergency care and we determine that you need more specialist care, at the emergency department, we are connected to a bigger group of specialists and consultants across the hospital who will come to you in the emergency department to continue that care that you may require, that special care that you may require. So we will not say, go to the specialist. No, the specialist will come to you because in an emergency, the care comes to the patient, okay? And so all the care that you require, even to the most critical kind of interventions and care, will come to you here in the emergency department because our priority is to make sure that you're stable before we move you to any other department or any other unit in the hospital. And that's the function of the emergency department. So you should feel very comfortable when you come to the emergency department that the nurse knows exactly what's wrong with you, and we prioritize your care based on the urgency of your clinical presentation. And as you sit in the emergency in the waiting area, please do not panic. We know you're there, and if you have any concerns, always talk to the triage nurse and she'll be able to address your concerns appropriately. Otherwise, welcome to the emergency department.